What's up everyone? Welcome back to my channel. My name is Fedi and welcome to my channel, and today I'm gonna try to answer the most frequently asked question on this channel, and that is, how do I know which type of vitiligo do I have? As you guys may know, a new cream called OPZELURA, ruxolitinib, got FDA approved last summer for the treatment of non-segmental vitiligo. And I actually made a video about it where I discussed its mechanism of action as well as the results and outcomes found in the two phase 3 clinical trials conducted prior to its FDA approval. So I suggest you pause this video, go watch that one first, and then come back. Also, please like the video and subscribe if you haven't yet. But some of you guys kept asking me about the word non-segmental, and although I tried to briefly give an explanation for it on my last video, I felt like doing another one where I will give you guys some clinical features as well as criteria you can use from the comfort of your own home to try to guess whether you have the segmental or the non-segmental variant of vitiligo. I will not be discussing the causes nor the pathogenesis of vitiligo on this video. I already did that on my last video, and if you guys want, you can write in the comment section and I will make a separate video where I will delve even deeper into the details of how it all works in the body. Oh, and one more thing. I want to stress it out, guys. No one besides your doctor with whom you will consult in real life, hopefully, can know for sure whether you have the segmental or the non-segmental variant of vitiligo. I don't want you guys to self-medicate and potentially cause more harm than good. So with that being out of the way, let's jump into the first clinical feature. The first question you want to ask yourself is the disease onset. Obviously, how old were you when you first started to notice the depigmentation appear on your skin? And for segmental vitiligo, it's very common to see patients have vitiligo starting to develop before the age of 10. And for non-segmental vitiligo, there is no age criteria really, so no characteristic over there. So you can use this as an elimination criteria. If your vitiligo started to appear in your late 20s or 30s, chances are you have non-segmental vitiligo. Disease onset is really important, but when consulting with your dermatologist, you'll often find them asking you about the progression and evolution of your disease. So for segmental vitiligo, it's very common to see patients have vitiligo spreading very rapidly. So it starts off, for example, at the age of 7, and over the course of 1.5 years, 2 years, it keeps spreading until it depigmentates the whole dermatomal region. And I will explain what I mean by dermatomal region in just a second. But disease progression in segmental vitiligo is 1.5 to 2 years, and then it tends to stabilize and doesn't progress anymore. So one clinical case we often hear of is this white patch started to appear on one side of my child's face or trunk, and over the course of 1.5 years, it kept getting bigger and bigger, but then it stopped and it never crossed the midline to the other side. And that's pretty much a good indicative of segmental vitiligo. In contrast to that, non-segmental vitiligo is usually constantly progressing and evolving. It is unpredictable. Some patches can disappear and then reappear, and unfortunately, it usually keeps getting worse as you age. The third criteria dermatologists look into to assess someone's vitiligo, and it's pretty much the most important one, is the distribution of the depigmentation on your skin. So something to be aware of is that segmental vitiligo, almost in 90% of cases, never crosses the midline of the body to the other side. So it is usually unilateral on one side of the body. And why is that? Well, it has, as you may have guessed it, something to do with the mechanism of how it actually works. Contrary to non-segmental vitiligo, the segmental type only affects one region of the skin called dermatome. So what is a dermatome? Dermatome is defined as an area of the skin innervated by one spinal nerve. So what does that mean? In our spinal cord, we have 31 pairs of nerves coming out of it, and each nerve innervates and supplies one area of the skin, and that area corresponding to one spinal nerve is called dermatome. And we're not sure of the exact mechanism of segmental vitiligo, but we're certain that it has something to do with an anomaly of the melanocytes along that path of one spinal nerve, meaning with the path of the dermatome. So it usually appears as unilateral patches following one dermatome and therefore never crosses the midline. On top of that, you should know that it's very characteristic for segmental vitiligo to follow the path of the trigeminal nerve, the second and third to be specific, branches of the trigeminal nerve, meaning on the face or on the trunk. But for non-segmental vitiligo, we can see it basically anywhere. It can touch the armpits, it can touch the hands, it can touch the face, it can touch the genital region, even the mucosa. Whether it's the lips or the genital mucosa is not spared by non-segmental vitiligo. And having a completely different mechanism of action, being autoimmune, meaning non-segmental is autoimmune, it can cross the midline, it can be bilateral, and actually it usually is bilateral, as opposed to being unilateral on one side of the body in segmental vitiligo. So, segmental vitiligo, one side of the body, non-segmental, two sides, usually. In addition to all of that, it is very crucial that during the consultation you take very good history of the patient, because if my patient has other autoimmune conditions besides his vitiligo, that pretty much suggests to me that he has the autoimmune vitiligo, the non-segmental vitiligo. And that's because there's a strong association, and that has been shown by various clinical research, that there's a pretty big association between the autoimmune vitiligo and other autoimmune conditions, especially conditions touching the thyroid gland, stuff like Graves' disease or thyroid of Hashimoto, for example, but also touching the adrenal gland like Addison disease, pancreas like type 1 diabetes, and other autoimmune skin conditions. So you should be aware of that. Actually, in some studies, I think there's association as high as 20% or 15%, that if you have an autoimmune vitiligo, you probably have one of these conditions. So I will make sure to list some of the studies in the description. One bonus criteria you could look into is you could look into one of these signs, Koebner phenomenon and leukotrichia. So what is Koebner phenomenon? Koebner phenomenon is defined by the appearance of new skin lesions on previously unaffected skin secondary to trauma. And leukotrichia is basically the loss of the color of hairs in a specific area of the skin. And I will make sure to make a separate video, especially about Koebner phenomenon, because this is really interesting. Koebner phenomenon, along with 3 other criteria, is a good indicative of the activity of one's vitiligo. So make sure to write in the comment section if you want me to make a separate video about it, how you could know clinically if your vitiligo is finished spreading or is it going to progress more and more. And the last criteria is the response to treatment. Yes, guys, we can differentiate between segmental and non-segmental vitiligo by how they respond to each treatment. So for segmental vitiligo, we basically know that it will be stable for the rest of the patient's life. So we can go ahead, and actually the first choice treatment here is to do what is known by a melanocyte transplant. But unfortunately, as its mechanism of action is not autoimmune, creams and glucocorticoids and stuff like JAK inhibitors like ruxolitinib, OPZELURA is not effective here. So people with segmental vitiligo unfortunately have no choice but to do a melanocyte transplant. For non-segmental vitiligo, you have a lot of options, and you can go ahead and watch the video I made if you want to know more about the treatment of non-segmental vitiligo. So that sums it up, guys. If you made it this far into the video, please make sure to like the video if you found it informative. Please write in the comment section which topics you want me to talk about in the future, whether about vitiligo, whether about hair loss, androgenic alopecia, or other subjects. And as always, stay safe.